The operating room went dead silent when six Special Forces soldiers walked through the doors in full combat dress and snapped into a sharp salute, not toward the chief surgeon standing at the head of the table, not toward the hospital administrator frozen in the doorway, but toward the quiet night nurse in the corner, who hadn't said a word in 10 minutes. She was the one they'd been looking for. She was the one they trusted with the life on that table. And she was the same woman the head surgeon had just ordered security to throw out of the building. If this story has you hooked already, stay with me until the very end. Hit like, drop a comment with the city you're watching from, and subscribe so I know exactly how far this story has traveled. Let's get into it. The night Claire Weston arrived for her shift at Harlow General Hospital, the parking lot was half empty, and the sky had that flat gray quality that made everything look like it had already given up. She parked in the back corner like she always did, not because she had to, not because anyone assigned her that spot, but because she'd learned early that taking up less space made the days go smoother. That was the calculus of survival in a place like Harlow General. You stayed quiet, you did your job, and you tried not to need anything from anyone. She was 31 years old. She wore her dark hair pulled back tight, no jewelry, clean scrubs, shoes that didn't squeak on linoleum. She kept a small notebook in her left breast pocket and a secondary penlight clipped beside it. Most of the other nurses on the night rotation had learned not to bother her about the penlight. She used it differently than they did, checking pupils in a specific sequence, holding angles that weren't taught in nursing school. And when anyone asked, she just said old habit and changed the subject. Nobody at Harlow General knew much about Claire Weston before nursing school. She didn't talk about it. She answered direct questions with short, true answers and left enough out that the questions tended to stop. She'd been at the hospital for 8 months, long enough to know the rhythms of the night shift, the names of every patient on the critical care floor, the particular way the second elevator shuddered before it opened, long enough to have earned a quiet kind of respect from the other nurses, the kind that doesn't get announced, just accumulates. She had not earned that same quiet respect from the surgical team. Dr. Marcus Frey was the chief of surgery at Harlow General, and he had made his opinion of the nursing staff clear in the way that certain men make things clear. Not with a single statement, but with 1,000 small performances. The way he talked over nurses when they were mid-sentence. The way he addressed them by their first names and expected to be addressed as doctor. The way he had once, in the middle of a pre-op briefing, referred to the nursing notes as housekeeping paperwork, and then looked directly at Claire when he said it, as though confirming something he'd already decided. He was talented. That much was undeniable. His complication rates were low, his technique was clean, and the hospital administration spoke about him in the particular warm tones reserved for people who bring in both results and money. He had plaques on his wall and his name on a fellowship program, and a habit of walking the halls like the floor had been built for his specific footfall. Claire had watched him work 3 times from the gallery. She hadn't said anything about what she observed. She'd written a few notes in her personal notebook and kept them to herself. That restraint would last exactly 8 more months. The call came in at 11:47 p.m. on a Thursday. Trauma bay, multiple incoming. That was all the initial dispatch said. Claire was 2 hours into her shift doing rounds on the critical care floor when the overhead crackled and the night-charge nurse, a steady woman named Paulette, who had been at Harlow General for 19 years, leaned out of the nursing station and said, "Weston, trauma's pulling everybody. They need hands." Claire was already moving. The emergency bay was controlled chaos when she arrived. 2 of the 3 bays were occupied with relatively minor cases, a motorcycle accident, a construction fall. But the third was different. A man had come in unresponsive, no ID, no next of kin, transported by a private vehicle that had peeled out of the ambulance bay without stopping. The paramedics who'd met him at the entrance said the driver had been military, had spoken in clipped sentences, had said only that the patient needed a trauma surgeon immediately and that more people were coming. Claire looked at the man on the table. He was somewhere in his late 30s, heavily built, with the kind of lean muscle that didn't come from a gym. His shirt had already been cut away. There were older scars on his torso, at least 3 that she could identify without getting closer, the kind of scars that didn't come from surgical suites. His blood pressure was reading low. His breathing was labored in a way that the team in the bay didn't seem to have noticed yet, or had noticed and categorized incorrectly. She stepped closer. Someone get a chest film right now, she said to no one in particular, in the same even tone she used for everything. One of the residents, a young man named Garrett, who was still learning which end of the hierarchy he occupied, looked at her and then looked away, which was the universal hospital gesture for "you don't outrank me here." Dr. Marcus Frey arrived 4 minutes later. He came in with his sleeves already rolled up, his manner announcing that the room should reorganize itself around him, which it did. He glanced at the monitors, put his hands on the patient's abdomen, asked 2 questions of the resident, and then straightened up with the expression of a man who has already made his decision. "Tension pneumo on the left," he said. "We're taking him to the OR, needle decompression, then open the chest and see what we have." Claire was standing at the foot of the bed. She had not been acknowledged. She looked at the patient's neck, then at his chest, then at the monitor reading. "His trachea is deviated," she said. Frey looked at her the way he always looked at nurses when they spoke, a moment of assessment followed by a visible recalibration toward patience. "I see that. It's deviated right, not left. If this is a tension pneumo, it should be pulling away from the affected side." She kept her voice level. "Left-sided compression would push the trachea right, but his breath sounds are actually reduced on the right." The room was quiet for exactly 2 seconds. "That's because he's splinting," Frey said, not looking at her anymore. "Muscle guarding. He's protecting the left side. We've all seen this presentation." "I've seen it too," Claire said, "but his neck veins are distended bilaterally. That pattern doesn't match a standard unilateral tension pneumo." "And you have a surgical degree, Ms.?" He didn't actually know her name. "Weston." "No, but I'm asking you to look at the whole picture before you needle the left side." Frey turned fully toward her then, and something shifted in his face. Not anger exactly, but the hardening of a man who had just decided this interaction needed to end publicly so it would serve as a lesson. "Ms. Weston," he said, "thank you for your input. This patient needs surgery, not a seminar. You're here to monitor and document. Do that or find somewhere else to be useful." "I think you're going to make it worse," she said quietly. There it was. Not a shout, not a performance, just a clear statement delivered without apology. The resident looked at the ceiling. 2 nurses near the equipment cart found reasons to look at their hands. Paulette, who had just arrived in the doorway, went very still. Frey took a breath. He was a man who chose his public moments carefully, and this was clearly one he'd selected. "Security," he said to the room at large. "Please escort this nurse out of the trauma bay. She'll need to be logged for disrupting an active trauma response." Claire didn't argue. She handed her monitoring tablet to the nearest nurse, unclipped her ID badge from her scrub top, and set it on the equipment cart as she walked toward the door. Not slammed down, not thrown, set down with the same deliberate calm she'd used the entire time. She walked out of the trauma bay and into the corridor. In the hallway, under the fluorescent lights that hummed slightly off-key, she stopped and stood with her back against the wall. Not because she was about to cry. She wasn't. Not because she was waiting for someone to come after her, sure she knew no one would. She stood there because she was running probabilities, and the probabilities were not good. The patient's pressure had been 84/50 when she left. The tracheal deviation was real. She'd seen it twice in her life before, and she knew what it meant. If Frey proceeded with left-side needle decompression on a patient whose pathology was on the right, he would relieve nothing and might accelerate a tension scenario that was already spiraling. She pulled her notebook from her pocket, uncapped the pen, wrote down the time, the vital signs she'd memorized, the clinical observations she'd made, the sequence of events. She wrote in the small, precise handwriting she'd developed in another life entirely, the handwriting of a person who had filled out field medical reports in dim light with cold hands and known that accuracy was the difference between a soldier going home and a soldier not going home. She was on the 4th line of notes when she heard the convoy. On. She heard them before she saw them. Not sirens, not the mechanical moan of regular emergency vehicles, but something different. A lower, more organized sound. The kind of sound that comes from vehicles designed for weight and coordination rather than speed. She walked to the window at the end of the corridor. 3 vehicles in the ambulance bay. 2 armored black SUVs flanking a larger transport that she couldn't fully see yet. and men, 6 of them, climbing out of the vehicles with the particular efficiency of people who move as a unit, who have trained together until individual decision-making has been replaced by something faster and more automatic. One of them was already on his radio. She recognized the posture before she recognized anything else. The way they held themselves, the discipline in every joint, the way their eyes swept the building entrance with a quality of attention that most people never develop and can't fake. She was moving before she'd consciously decided to move. By the time she reached the main entrance, the lead officer, a man in his early 40s with a jaw like quarried stone and the kind of stillness that comes from years of training yourself not to show anything, was already talking to the front desk administrator, who looked like a woman who had signed up for intake paperwork and was not prepared for this conversation. "We have a man in your trauma bay," the officer was saying. "We need to know his current status, and we need to speak with whoever is making surgical decisions. Sir, I can't confirm patient information without... His name is James Callahan, retired Special Forces, currently active status under a classified operational contract. If you open him up before you understand what's inside him, your surgeon is going to kill him." The administrator looked around the lobby with the expression of a person searching for someone whose problem this was. Her eyes landed on Claire. The officer's eyes followed. He went still in a way that was different from his previous stillness. Not the trained stillness of operational awareness, but the stillness of genuine recognition. Then he said a word. A single word that wasn't a name. It was a call sign. An old one. The kind that gets assigned and then becomes more real than the name on your birth certificate. And he said it with the particular weight of a man who has been looking for someone he wasn't sure he'd find. Claire closed her eyes for exactly 1 second. Then she said, "Sergeant Major Briggs, how long ago did this happen?" 40 minutes, he said. "He's been symptomatic for at least an hour before that. We couldn't get him to a military facility in time." "Who authorized the chest surgery?" "Surgeon up there named Frey. We tried to get him to wait. He said he had the call." "He does have the call," Claire said. "He's also going to kill your man if he makes a left-sided approach." She was already walking toward the elevator. "Come with me." Briggs turned to his unit. "All of you. With me. Now." The elevator was too small for 7 people, so they took the stairs. And when they hit the surgical floor, the 2 hospital security guards stationed at the entrance had exactly enough time to register what they were looking at before Briggs held up a credential that made the senior guard take a full step backward. "We're not here to cause a problem," Briggs said. "We're here to prevent one." The guard stepped aside. The surgical floor was a different world from the ER. Quieter, more controlled, the kind of sterile calm that gets maintained through professional habit. A scrub tech was pushing a supply cart toward the OR suite at the end of the hall. A resident was updating a chart at the nursing station. Paulette was standing with her arms folded near the double doors, and when she saw Claire coming, she didn't look surprised. Paulette had a way of not looking surprised that Claire had always admired. "He's prepped," Paulette said quietly. "Frey's about to make first incision." "Not yet he isn't," Claire said. She pushed through the double doors. The OR had that particular charged quality of a room where people are about to do something that cannot be undone. Frey was gloved, gowned, and standing at the patient's left side with his resident angled across from him. The anesthesiologist, a compact, careful man named Dr. Ortega, whom Claire had crossed paths with before, was at his station, and the scrub nurse had already laid out the chest tray. Frey looked up when the doors opened. Whatever he'd expected to see, it wasn't this. "This is a sterile field," he said. "Nobody comes in here without..." "Dr. Frey." Briggs's voice was the kind of voice that had been trained in environments where being heard over artillery fire was a professional baseline. It wasn't loud. It didn't have to be. "I'm Sergeant Major Daniel Briggs, Shadowlance Task Group. The man on your table is one of my operators. We have standing authorization from the Department of Defense for medical oversight on any procedure involving active classified personnel. I need you to stop." "I don't know what authorization you think you have, but this hospital..." "The paperwork is already with your administrator," Briggs said. "She's calling your department chief right now, but we don't have time for that conversation. This woman," he gestured toward Claire without looking away from Frey, "needs to examine your patient before you open him." Frey's eyes moved to Claire. In the 8 months they'd worked in the same building, she had watched his face cycle through several expressions in relation to her. Dismissal had been the default. Condescension had been the active setting. But this was something new. This was a man looking at a person he had categorized and filed, and now finding that the file was wrong, completely wrong, in a way that destabilized not just this moment, but every moment that had come before it. "You're a night nurse," he said. The words came out like a question dressed up as a statement. "I'm asking you to step back from that incision for 90 seconds, Claire said. She was already pulling on a fresh pair of gloves from the cart. "If I'm wrong, you proceed, and I'll never say another word to you. If I'm right, we need a different approach." Ortega spoke from his station. "Claire," his voice was quiet. "The pressure's been dropping for the last 3 minutes." "I know." She was already at the side of the table, her gloved hands moving with a specificity that made Frey go very still. "You were about to open the wrong side," she said, not to him, to the room, to the surgical team, to the scrub nurse, to the resident who was watching her with an expression of stunned attention. "The pathology isn't on the left, it's on the right, and it's not just a pneumo. Look at the chest film, really look at it." She pointed to the light box where the film was clipped. The room looked. It was Ortega who said it first, in a voice that had gone careful and very quiet. "She's right. Look at that hemidiaphragm. That's right-sided hemothorax," Claire said. "Significant volume, possible aortic branch involvement. If you go left side, you decompress nothing and you lose him in the first 60 seconds. She turned to face Frey directly. "He needs a right thoracostomy, now. And then we need to get imaging on that aorta before we do anything else." The room was absolutely still. On the monitor, the patient's pressure dropped 2 more points. Frey didn't move. Claire looked at him. Not with anger, she was too focused for anger, but with the directness that didn't leave room for his ego to find purchase. "Marcus," she said. It was the first time she'd ever used his first name. "He's going to die in the next 4 minutes if someone doesn't make a decision. It doesn't have to be you, but it has to happen now." Something moved across Frey's face, something complicated and not entirely resolved. And then he stepped back. He stepped back from the table. He looked at Ortega. He looked at the film. He looked at Claire's gloved hands already positioned, and he said nothing, which was the only thing in that moment that counted as the right answer. The OR team moved. Paulette, who had followed them in and was already scrubbed, handed Claire the chest tray, and they shifted positions without discussion, without ceremony, without anyone announcing what was happening. Because what was happening didn't need announcing. It was simply, urgently, immediately, the only thing that mattered. Claire's hands moved with a certainty that nobody in that room had seen from her before. Nobody in that room, except for the man on the table who had seen it in very different circumstances, in very different places, and who could not see it now because he was unconscious and running out of time. But the certainty was there, in every angle, every choice, every second of measured, controlled action. And Ortega saw it, and the scrub nurse saw it, and even Frey saw it, standing there at the edge of the room with his arms at his sides. The monitors screamed. The patient flatlined. And Claire said in the same even voice she'd used all night, in the same voice she'd learned to use when everything was falling apart, and calm was the only available tool. "I've got him. Everybody hold." The flatline held for 4 seconds. 4 seconds is not a long time in most contexts. In an operating room with a man whose heart has stopped and whose chest is open and whose blood pressure had already been circling the drain for the better part of an hour, 4 seconds is a complete eternity. Claire didn't panic. That was the thing nobody in the room could fully process in the moment. She didn't panic, didn't freeze, didn't cycle through the stages of alarm that most people cycle through when a monitor starts screaming. She had already been 3 steps ahead of the flatline before it happened. The way you learn to be 3 steps ahead of things when being 3 steps behind means someone dies in the dirt on the other side of the world, and you carry that with you for the rest of your life. "Ortega," she said, "push epi, 1 milligram. "Already drawn," he said. "Good. Hold it until I say." Her hands were inside the chest cavity, and she was working by feel and by a kind of spatial knowledge that doesn't come from textbooks. It comes from doing this in conditions so bad that you have to memorize what everything feels like because you can't always see it. There's a tear in the right intercostal branch, partial. It's been bleeding slow, and then it wasn't slow anymore. She applied pressure with 2 fingers, precise and firm. Frey, I need you back at this table. He was there before she finished the sentence. Whatever had happened to Marcus Frey in the moment he stepped back, whatever internal reckoning had taken place in the 60 seconds since, he arrived at the table as a surgeon, not as a man managing his reputation. That was the most she could ask for, and it was enough. Hold pressure here, she said, and guided his hand to the exact point without ceremony. Don't move until I tell you. What are you looking for? Whether the tear extends posteriorly. If it does, we need a different approach, and we need it in about 90 seconds. She was already assessing, her fingers tracing the anatomy with that unsettling particular confidence. Ortega, push the epi. The drug went in. The monitors continued their flat protest for another 3 seconds, 3 more eternities, and then the line spiked. Irregular. Weak. But there. The room exhaled collectively, which was the wrong instinct, because the next 30 minutes were going to be harder than the last 10. It's contained, Claire said. The tear doesn't extend. We can repair it right-sided without going posterior. She looked at the scrub nurse, a young woman named Dara, who had gone very pale but was still holding her position at the instrument tray. I need a 4-0 proline and a pledget. Tell me you have that. I have it, Dara said, and her hands were steadier than her face. Good. Hand it to Dr. Frey. There was a half-second where Frey processed that. The fact that she was handing the repair back to him, that she wasn't trying to take the whole thing, that she understood exactly where her role ended and where his needed to begin. And something in his jaw unclenched slightly, just slightly, in the particular way of a man who had been prepared for a fight and found something else instead. He took the suture. He worked. Sergeant Major Briggs had not left the doorway. He stood there through all of it, the flat line, the epi-push, the repair, with his arms folded and his face completely controlled, which was itself a kind of discipline, because every person in that room could feel how much he wanted to ask questions and how hard he was working not to. The 5 men behind him in the corridor were the same. Absolute stillness, absolute restraint, waiting. It took 22 minutes to complete the repair and stabilize the bleeding. When it was done, when the monitors were reading something that could be called stable, when Ortega had leaned back in his chair with the particular slump of a man who has been holding his entire body rigid for the better part of an hour, Claire stepped back from the table and stripped off her gloves. She was aware that her hands were not entirely steady. She was aware that she was sweating through her scrub top. She was aware that the room was looking at her in a way it hadn't looked at her before, including Frey, who was standing very still at the head of the table with an expression she didn't have the bandwidth to interpret right now. She walked to the doorway. Briggs stepped aside to let her through into the corridor, then followed. Is he going to make it? Briggs asked. He needs another hour of monitoring and then probably a second look at that repair under better imaging. But yes, she leaned against the wall. Probably. Probably, he repeated. That's what I've got right now, Briggs. Probably is better than what he had 40 minutes ago. He nodded. It was a slow, weighted nod, the kind that carries more than agreement. You look like hell, he said. I've looked worse in worse places. Yeah. He was quiet for a moment. You have. The hospital's response to what had just happened arrived in stages, the way institutional responses always do. First confusion, then communication, then people appearing in corridors who had not been there before. Dr. Howard Kellner, the chief of medicine at Harlow General, arrived on the surgical floor at 1:34 a.m. in a suit that suggested he'd been awake when the call came in, which was itself a data point. He was a tall man in his early 60s with the bearing of someone who had navigated too many crises to be visibly shaken by them. But his eyes were doing a rapid assessment of the hallway, the soldiers, Claire, the OR suite at the end, Frey, who had emerged and was standing slightly apart from everyone with the posture of a man processing something alone. Someone tell me what happened in that room, Kellner said. Briggs introduced himself with the same credential he had shown at the entrance. Kellner looked at it, looked at Claire. looked at Frey. Frey said, "She caught a misdiagnosis. Right-sided hemothorax, possible aortic branch involvement. I had the patient prepped for a left thoracostomy." The way he said it was not comfortable. It was not a performance of humility. It was a man making himself say an accurate sentence out loud, when every instinct he had was telling him to find a more comfortable framing. Claire noticed that. She filed it. "And the patient is currently," Kellner started. "Stable," Claire said. "Relatively. He needs close monitoring through the night, and I'd want to get a CTA in the next 2 hours to confirm the repair is holding." Kellner looked at her for a long moment. He'd seen her before. She'd been in enough departmental situations that he knew her face. But the way he was looking at her now was different. He was recalibrating, and unlike Frey, he didn't seem resentful about it. "What's your background?" he said. "Prior to nursing." "Military," she said. "Combat medicine." "How long?" 7 years active, 2 more attached to special operations units in an advisory capacity. Briggs said, "She developed the intercostal trauma protocol that 3 separate special forces units currently use in the field. Our operators have a better survival rate in penetrating chest trauma situations because of procedures she wrote." He said it without inflection, as a person states a fact. Kellner absorbed this. Then he turned to look at Frey. The look between them lasted a beat too long to be a neutral administrative exchange. It was Paulette who found the first irregularity, and she found it the way Paulette found most things, by paying attention to something everyone else had decided didn't need attention. She'd gone back to the nursing station after the OR stabilized, partly to decompress, and partly because she was the kind of person who processes difficulty by returning to routine. She was updating the patient's chart, James Callahan, now officially on record, when she noticed the flag. Not a medical flag, an administrative one. The patient's pre-surgical chart had been accessed and updated twice in the 40 minutes between Claire's removal from the trauma bay and the moment the military convoy arrived. The update timestamps matched the window when Frey had been in the bay, alone with the patient and his resident. She pulled the update history. The original nursing intake notes, which included Claire's initial observation about the bilateral neck vein distension and the tracheal deviation pattern, because Claire had been logging the chart before she was escorted out, had been edited. The entries weren't deleted. They'd been reclassified. Moved from active clinical observations to a field labeled Nursing Aid Supplementary Notes, which was a category that had a lower clinical weight in the hospital's triage algorithm. A categorization that, in practice, meant that those observations would not have triggered an automatic second review flag when the surgical plan was entered. Paulette sat with this for a moment. Then she printed the access log, folded it, and put it in the pocket of her scrubs. She didn't go to Kellner. Not yet. She went to Claire. Claire was in the family consultation room at the end of the corridor, not because she had a family to consult, but because it was the only room on the floor with a door that closed and no reason for anyone to walk into it at 2 in the morning. She was sitting in one of the chairs with her notebook open on her knee, writing the full clinical sequence of the night in the same small, precise handwriting, because she had learned a long time ago that the record you keep yourself is the only record you can fully trust. Paulette came in without knocking, which was exactly the right call. She handed Claire the printed log without preamble. Claire looked at it. Read it twice. Her expression didn't change much, the same controlled attentiveness she brought to everything, but something in her posture shifted slightly, a very small recalibration that Paulette, who had known her for 8 months, read correctly as the shift from uncertain to certain. "When were these changed?" Claire asked. "Between 11:52 and 12:09, Paulette said. "That's the window after you left the bay. Frey and the resident were the only ones logged in on that chart during that time." "Does the resident know about this?" "I don't think so. He's been in recovery monitoring since the surgery ended. He looked like a kid who needed to sit down." Claire nodded slowly. "Paulette, this can't come from you. I know that. I mean it. Whatever comes next, you found a routine discrepancy and flagged it to me as the documenting nurse. That's the language we use. Routine discrepancy." "Claire," Paulette's voice was level and unbothered, "I've been in this hospital longer than Frey has. I know how this works. She paused. What I'm asking is whether you know what to do with it. Claire looked at the printed log. In another life, in another chain of command, she would have known exactly what to do and exactly who to bring it to, and there would have been a process, not a clean one, not a fast one, but a process with teeth. She was trying to map those coordinates onto the civilian hospital system and find where the teeth were. I need to make a call, she said. Military? The legal officer attached to Briggs's unit. If Callahan is active under a classified contract, his medical records have federal oversight. Altering them isn't a hospital administrative issue. She folded the printout carefully. It's a federal one. Paulette stood for a moment in the doorway. 8 months, she said. I watched you take his garbage for 8 months, and never once. She stopped. I should have said something earlier. You couldn't have known. No, but I should have said something anyway. She straightened up. I'll go back to the station. Call whoever you need to call. She left. Claire sat alone in the consultation room for 30 seconds, which was as long as she allowed herself before she picked up her phone. The call to Briggs's JAG officer took 6 minutes and resulted in a conversation Claire did not fully relay to anyone afterward, but which ended with the officer asking her to secure the original document, ensure the digital access log was preserved by someone with no conflict of interest, and under no circumstances allow the chart to be accessed again before a federal medical investigator could be dispatched. The investigator, the officer said, could be there by morning. Claire relayed the document preservation instruction to Paulette through a text message in 3 words: lock the chart. Paulette, who had apparently anticipated something along these lines, responded with a single period, which meant she'd already done it. By 3 a.m., James Callahan was in a monitored recovery room. His pressure was holding. His color was returning. Ortega had been in twice, both times leaving with the particular expression of a man reassessing his assumptions in real time. Frey had not come back to check on the patient. Claire noticed that. She noticed it and wrote it in her notebook, and then sat in the chair beside Callahan's monitoring station in the recovery room. Not because anyone had asked her to, not because it was in her job description, but because she was a person who had carried men out of places no one should have to be carried out of, and sitting beside them afterward was the part she had never been able to give up entirely. The monitor beeped, slow and steady. The number climbed 2 more points. She was still sitting there when Callahan's hand moved, a small, involuntary flex at first, the kind of movement that precedes consciousness rather than announcing it, and then his eyes opened, unfocused, moving through the standard sequence of a person surfacing from anesthesia. He looked at the ceiling. He looked at the monitor. He looked at Claire. Something moved through his expression that wasn't confusion, not quite. It was the look of a man who has woken up in unexpected places often enough that he has developed a system for orienting himself, and who has now arrived at the last variable in that system, which was the person sitting beside him. His mouth moved. No sound came out. He swallowed. Easy, Claire said quietly. You're at Harlow General. You've been in surgery. You're stable. He looked at her for another long moment. His eyes, she noticed, were very clear for someone who had been under anesthesia for nearly 2 hours. The kind of clear that came from a person who was always watching even when they shouldn't be able to. He said one word, barely audible. Weston. She went still. You know me, she said carefully. It wasn't a question. His lips moved into something that was almost a smile, except that smiling clearly hurt. Kandahar, he said. 214. The room felt very quiet all of a sudden. Claire sat forward in her chair, and the notebook on her knee fell to the floor, and she didn't pick it up. You were in 214, she said. He closed his eyes, nodded once, very slightly, then opened them again and looked at her with the focused, exhausted attention of a man who needed her to understand something before he lost consciousness again. Frey, he said. Claire, Frey knows who I am. The monitor kept beeping, steady, unchanged. Outside in the corridor, footsteps were approaching the recovery room, 2 sets, quick and purposeful. And when Claire looked up at the door, the handle was already turning. The door opened, and it was Briggs. Just Briggs and one of his men, the youngest of the unit, a lean, watchful soldier named Tate, who had been stationed in the corridor all night and moved like someone who had learned to take up as little space as possible. Claire registered both of them in the half-second before she registered that Callahan's eyes had already closed again, his body making the executive decision that consciousness was too expensive right now and shutting the program down. She picked up her notebook from the floor. "He was awake," Briggs said, moving to the bedside with a kind of controlled urgency. He looked at Callahan's face, at the monitors, back at Claire. "What did he say?" "He was oriented. He recognized me." She kept her voice even. "He said Frey knows who he is." The silence that followed that sentence had a particular quality, the quality of a room where two people are running the same calculation and arriving at the same uncomfortable answer at the same time. "How would Frey know?" Tate asked from the doorway. "That's the question," Claire said. "Callahan was brought in unidentified. No ID, no next of kin, no paperwork. The driver didn't stay long enough to provide intake information. So officially, from the moment he arrived until your unit showed up with his name, he was a John Doe." "Officially," Briggs said. "Right." She looked at the door. "Someone want to explain to me how a man who arrived as a John Doe ended up with an attending physician who knows his operational status?" Nobody explained it, because nobody had the explanation yet, and the three of them sat with that fact in the quiet of the recovery room while the monitors kept their steady rhythm and Callahan kept breathing. Briggs's radio crackled. He stepped into the corridor to take the call, and through the door Claire heard fragments. "Investigator, 6 a.m., federal jurisdiction." And then his voice dropped, and she stopped hearing anything useful. She looked at Callahan. 2:14, she said quietly, to the sleeping man, to the room, to no one. She hadn't said that number out loud in 4 years. It was a designation, not a name. A task group identifier that had stopped existing on paper the moment the operation concluded, scrubbed from official records along with most of the details of what that operation had involved. She knew Callahan had been in 214 the way she knew where every scar on her own body came from, not because anyone told her, but because she had been there. And she had a functional memory, and some things were not the kind of thing you forgot. What she didn't know was why a surgeon at a mid-sized civilian hospital in Asheville would know the name of a man who had, on paper, spent that particular year doing nothing more classified than routine training rotations. That was a large and uncomfortable thing not to know. The federal medical investigator arrived at 5:47 a.m., which was 13 minutes earlier than promised, which Claire took as an indication that someone higher up the chain had made a call after Briggs's JAG officer made his call, and the whole thing had accelerated in the way that things accelerate when they touch classified infrastructure. Her name was Investigator Sandra Voigt, and she arrived with two people Claire was never introduced to, who carried laptops and spoke to each other in the specific shorthand of people who do records work for a living. Voigt herself was somewhere in her mid-50s, with short silver hair and the kind of face that had learned to give nothing away without becoming unkind. She shook Claire's hand, shook Briggs's hand, and then asked to see the chart access log before she asked anything else. Paulette produced it from the nursing station along with a printed timestamp record she had apparently prepared independently, which made Claire feel the particular warm solidarity of watching someone do exactly the right thing without being asked. Voigt looked at both documents for about 90 seconds without speaking. Then she said, "Who else has accessed this patient's record since the flag was placed?" "Nobody," Paulette said. "I locked it at 2:08 a.m. The system log will show no accesses after that." "And the edits to the nursing intake notes?" Voigt looked up. "These reclassified entries, who made them?" "The access log shows Dr. Frey's credentials," Paulette said, "and his resident, Dr. Garrett Hale. 2 separate login sessions, 4 minutes apart." "Is Hale still in the building?" "He finished his shift at 4. I don't know if he's gone." Voigt said something to one of her colleagues in a low voice, and the colleague left the station with a phone already at their ear. Claire watched this with the particular attention she brought to situations where she was not the most powerful person in the room, but needed to understand exactly what was happening. She had operated in those situations for the better part of a decade, and she was good at it, tracking the power dynamics, understanding what she could influence and what she needed to leave alone, finding the exact pressure point where her input would be useful. Right now, the pressure point was Frey. "Where is he?" she asked Voight. Voight glanced at her. "We're working on locating him." "He hasn't been back in the building since approximately 1 a.m., Claire said. "He left the OR after the surgery stabilized, went to his office for about 12 minutes based on the keycard log. Yes, I checked. And then left the building. His personal vehicle is still in the physician's parking structure." Voight looked at her with an expression that wasn't quite surprise, more like the expression of someone who has done enough of this work to recognize a certain type of person when they encounter one. "You've been busy," she said. "I've been thorough," Claire said. "There's a difference." Voight handed the chart log back to Paulette. "Stay available. I'll need a formal statement from both of you within the hour." The hour that followed was not a single unbroken thread of events, but rather several things happening simultaneously in different parts of the hospital, which Claire could only track partially from her position in the recovery ward. Kellner arrived at 6 a.m. and went directly into a closed meeting with Voight and two people from hospital administration whose names Claire didn't know. Through the glass-walled conference room, she could see Kellner doing a lot of listening and very little talking, which was not his default mode, and which told her something about the nature of what Voight was presenting. Garrett Hale, the resident, was reached by phone before he'd left the hospital parking structure. Claire didn't witness that conversation, but Tate, who had been repositioned by Briggs to cover the main corridor, told her later that Hale had looked like a man who had been carrying something heavy since 1 a.m. and was about to set it down, whether he wanted to or not. Callahan woke up again at 6:22 a.m., this time fully and without ambiguity. He was alert, oriented, and in significant pain that he was managing with the specific silence of a person who has decided pain is not relevant information. Ortega adjusted his drip, and Briggs sat in the chair beside the bed and had a conversation with Callahan that lasted 11 minutes and that Claire was not part of. When Briggs came back out, his face was set in the particular expression of a man who has just had confirmed what he suspected and doesn't like being right. "Frey treated him before," Briggs said. "Not here. Privately. About 14 months ago, off the books. Callahan had a classified injury, I can't tell you the context, and needed medical attention that couldn't go through official channels. Frey was the contact." Will Claire absorb this? How did Frey become the contact? "That's what we're trying to establish," Briggs paused. "But Callahan says Frey knew enough about the injury to know what caused it, which means Frey had classified information he shouldn't have had. And if Callahan died on that table tonight, then the one person who could confirm what Frey knew and how he knew it would be gone." Briggs looked at the door to the recovery room. "And it would look like a routine surgical complication, wrong side decompression, tragic mistake, tragic outcome." The corridor was very quiet. The morning shift was beginning to arrive, nurses appearing at the station, the sound of the breakfast cart somewhere on a lower floor. And there was a particular dissonance between the ordinary rhythms of the hospital morning and what Claire was holding in her hands. "He had the patient's chart," she said. "He knew about the tracheal deviation because I had already noted it. He knew if he redirected attention to the left side, the right-sided bleed would do the work for him." Is that what the evidence shows? It's what the evidence is consistent with. She was careful about the language. She had learned to be careful about the language in situations like this, not to reach beyond what the facts supported, because reaching beyond the facts was how things got thrown out and people walked away. The chart alterations are real. The misdiagnosis was real. The sequence of events is documentable. She paused. "What Callahan tells you about the prior contact, that's a different chain of evidence, but the two chains connect." Briggs nodded slowly. "Voight needs to hear all of this." "She's going to, but Briggs—" Claire stopped him. "Frey is still in the building. His car hasn't moved." "Then where is he?" She had been thinking about that for the last 20 minutes. The physician's lounge on the 4th floor was the one area of the hospital that had keycard access, but no continuous camera coverage. A gap in the system that had been raised in a facilities meeting 6 months ago and not yet addressed, because addressing it required a budget allocation that nobody had prioritized. She knew this because she had been in that meeting, and she had been the one who raised the coverage gap, and the administrator who responded had smiled at her in the particular way of people who have already decided not to act on something. "I have a thought about that," she said. "What?" She was right about the physician's lounge, but she was wrong about what she would find there. Frey was there. He was sitting in one of the leather chairs near the window with a cup of coffee he hadn't touched, still in his surgical clothes from the night before. And he looked like a man who had been sitting in that chair for a long time, doing the specific kind of thinking that doesn't get you anywhere but that you can't stop doing. He looked up when Claire opened the door. He looked past her at Briggs and at Tate behind Briggs, and his expression moved through several things quickly before settling into something that was exhausted and wary and not quite what Claire had expected. She had expected defiance. She had learned to expect defiance from men like Frey, the particular armor that professional certainty becomes when it's threatened. What she saw instead was something closer to a man who had been running a calculation all night and had finally arrived at the end of it and didn't like the answer. "I'm not going anywhere," he said. "I've been waiting." "Waiting for what?" Briggs said. "For whoever was coming." He looked at Claire. "I knew when you walked back into that OR that it was done. I just didn't—" He stopped, picked up the coffee cup, put it back down without drinking from it. "I didn't know how much you'd find." Claire stayed in the doorway. She was aware that this was a moment with legal dimensions that she needed to navigate carefully, that anything said here was potentially relevant to what Voight was building, that her role was observer and not interrogator, that the instinct she had to sit down across from this man and understand what had actually happened was not the instinct she should be acting on right now. But she asked one question because she needed to know. "The chart alterations," she said, "was that about protecting yourself medically, or was it about something else?" Frey looked at her for a long moment. "Both," he said. "At first, and then—" He shook his head. "It got complicated." "That's not an answer." "No." He looked at his hands. "It's not." Briggs stepped past Claire into the room, and that was the moment the conversation became something else, and Claire stepped back into the corridor and let it become that other thing, because that was her lane and she knew it. She stood in the corridor outside the physician's lounge, and she listened to the hospital coming to life around her. The shift change conversations, the overhead pages, the particular percussion of a morning at a trauma-level facility, and she felt the exhaustion arriving in her body the way it always arrived after a long operation, not as a single wave, but as a slow recognition, like something that had been waiting politely in the doorway and finally decided it could come in. She'd been awake for over 20 hours. The surgery had been over for 4. And she was still standing in the same building where, 8 months ago, she had made herself as small as possible and tried to stay out of the way. Voight's formal interview with Claire lasted 45 minutes and covered 4 distinct areas: the clinical sequence in the trauma bay, the specific observation she had made and documented, the chart alteration timeline as Paulette had established it, and, this was the part Claire had not fully anticipated, her prior relationship with James Callahan. "You knew him," Voight said. It wasn't phrased as a question. "I knew of him," Claire said carefully. "We operated in overlapping theaters during my time in service. I treated him once, in the field, under emergency conditions. We didn't maintain contact afterward. But you recognized him." "I recognized his physical profile and his scar pattern during the surgery. That's what prompted the question about his identity when he woke up." Voight made a note. "And when he said Frey knew who he was, what did you understand that to mean?" "That the misidentification wasn't accidental," Claire said. "That Frey had prior knowledge of the patient's identity and operative status, and that this knowledge was relevant to the clinical decisions he was making." "Can you prove that?" "The chart alterations prove the decisions were not clinically justified. The prior contact between Frey and Callahan is something Callahan will need to establish directly." She paused. "But the two things are connected. The alterations weren't about protecting a surgical mistake. They were about controlling what could be known." Voight looked at her. "Ms. Weston," she said, "what you did tonight, clinically, procedurally, that's going to be part of this record." "I know. There will be people who characterize it as a nurse overstepping her role during an authorized surgical procedure." "I know that too. And?" Claire considered the question seriously, because it deserved a serious answer. He would have died, she said. Everything else is secondary to that. Voight closed her notebook. She had a way of doing it that suggested she was finished with the official portion of the conversation, that what came next was something different. Garrett Hale, she said, the resident. He altered the chart because Frey told him to. He's 27 years old and he thought he was covering for an error, not for something else. She paused. He gave us everything. Timeline, instructions, the exact language Frey used when he asked Hale to reclassify the nursing entries. He was in the parking structure, shaking when we reached him. Claire said nothing. I'm telling you that because you'll see it in the record eventually, and I'd rather you hear the context now. Voight stood up. He wasn't part of the larger picture. He was just a resident who made a very bad decision under pressure from a man with considerably more institutional power. I understand, Claire said. Do you? Voight looked at her with the directness of a woman who had spent a career parsing the difference between people who said they understood things and people who actually did. Because what's coming is going to be disruptive for this hospital and for the people in it, and some of those people are going to look for someone to be angry at who isn't Frey. I've been someone people were angry at, Claire said. It's not new. Voight almost smiled. It didn't quite make it to a full smile, but it was close. No, she said. I don't suppose it is. Kellner found Claire in the recovery ward at 9 a.m., sitting in the chair beside Callahan's bed. Callahan was awake. Better. Eating ice chips with the focused attention of a man whose body was making demands that it had postponed all night. Kellner stood in the doorway in the particular way of people who have something to say and are working out how to say it. Can I speak with you in the hall? He said. She followed him out. Frey's surgical privileges have been suspended as of 40 minutes ago, Kellner said. That's pending the federal investigation, not contingent on it. The hospital's board made the call. He paused. There's also going to be a full internal review of his case record. The investigators' team is flagging similar documentation patterns in at least 3 other surgeries over the past 18 months. Claire was quiet. The nursing notes, Kellner continued, yours specifically, from last night. They're being restored to their original classification, and the intake record is being corrected. There will be an official acknowledgement of the clinical observations you made. He looked at her with the careful directness of a man making an accounting. I owe you an apology. The institution owes you an apology. For 8 months of... Dr. Kellner. She stopped him, not unkindly. The apology isn't what matters right now. What matters is what the review finds and what changes because of it. She looked at him steadily. If those nursing notes had been weighted correctly by the triage algorithm, the surgical plan would have triggered a second review automatically. That's a systems problem, not just a Frey problem. That's what needs to change. He held her gaze. Then he nodded, the slow, weighted nod of a man making a mental note that was also a commitment. What would you recommend? She told him. Specifically, clearly, without hedging. The protocol adjustments, the documentation weight changes, the independent clinical review trigger for any surgical plan that contradicted nursing observations logged within the preceding 2 hours. She had been thinking about it for longer than she'd admitted to anyone, and the words came out organized and ready, the way they always did when she'd been carrying something long enough that it had found its own structure. Kellner listened without interrupting. When she finished, he said, Will you put that in writing? I already have, she said. He blinked. The notebook, she said. I've been writing it all night. I'll have a clean version to you by end of shift. She went back into the recovery room. Callahan was watching her from the bed with the same clear, assessing attention he'd had the first time he woke up. You told them what needed to change, he said. It wasn't a question. Someone had to. You've been doing that since Kandahar. A pause. You never let anyone say thank you. I let people say it, she said. I just don't let it stop me from moving to the next thing. He made a sound that was something between a laugh and a wince. Still the same. Get some rest, she said. Your unit is going to want a full debrief when you're cleared, and Briggs has the patience of a man who is absolutely done being patient. Callahan closed his eyes, still almost smiling. Claire sat back in the chair. Through the recovery room window, she could see the corridor, Tate at his post, Voight's colleague moving past with a laptop, The ordinary traffic of a hospital morning settling into its rhythm. Normal things, moving over the surface of what was not normal at all. She was thinking about what Callahan had said. Frey knows who I am. She was thinking about the prior contact, the 14 months, the off-the-books treatment of a classified injury. She was thinking about what it meant that a civilian surgeon had access to a Special Forces operator's identity under those circumstances, and who had provided that access, and whether Frey had been the beginning of that chain or just a link in the middle. The more she thought about it, the more the shape of it expanded outward in a direction that made her uncomfortable. Her phone buzzed. A text from Briggs. Room 2, 4th floor. Now. She stood up. Room 2 on the 4th floor was one of the hospital's administrative conference rooms, the one with the external network port and the whiteboard that locked. She had been in it once before, for a department heads meeting she had attended in her capacity as charge nurse for the night, and which nobody had acknowledged she was in. She took the stairs. When she pushed open the door, Briggs was there, and Voight was there, and there was a man she didn't recognize seated at the table with a laptop open in front of him, and the particular bearing of someone who did not introduce himself unless asked, and preferred not to be asked. On the whiteboard behind him, someone had written 3 names. 2 of them she didn't recognize. The third was Marcus Frey. Beside Frey's name, connected by a line drawn in blue marker, was a set of initials and a case number that she absolutely recognized, because she had written that case number in a field report in a dust-covered forward operating base 4 years ago. And she had genuinely believed, that it had been buried so deep in classified infrastructure that it was functionally gone. The man with the laptop looked at her. "Sit down, Ms. Weston," he said. "We have some questions about Operation 214, and it appears you're the only person in this building who was actually there." She sat down. The unnamed man with the laptop had the particular stillness of someone who had sat in a lot of rooms like this one, and had learned that the first person to fill the silence usually gave away more than they intended. Claire understood that technique because she had used it herself, so she sat down, folded her hands on the table, and waited. He let it go for about 15 seconds. Then he said, "You filed a field medical report in March, 4 years ago, documenting a casualty event during an operation running under the 214 designation. The report included observations about the nature of the injuries sustained by 3 personnel, their treatment under your care, and your recommendation for follow-up surgical intervention upon extraction." "That's accurate," Claire said. "One of those 3 personnel was James Callahan." "Yes. The other 2 were listed under operational designations, not names, in your report." He looked at her steadily. "Do you know their identities?" Claire looked at Briggs. Briggs was watching the laptop man with his arms folded and his jaw set in the position it took when he was managing something carefully. "I know one of them," she said. "We know you do." The man turned the laptop to face her. On the screen was a photograph. Not a personnel file photo, not a formal headshot, but a surveillance-quality image, slightly grainy, taken from above and at an angle. A man outside a building, midday by the shadows. The building had a sign Claire couldn't fully read, but the partial lettering was enough. Medical something, a clinic logo she didn't recognize. The man in the photograph was Marcus Frey. Standing beside him, one hand on Frey's arm in the particular gesture of 2 people who know each other well enough to touch casually in public, was a figure Claire recognized in the way you recognize people you've only seen in high-stress conditions. The same way you recognize the smell of a place you haven't been to in years. Not from their face, because the angle was wrong. From the way they stood. "Who took this?" she asked. "This photograph was taken 11 months ago," the man said, not answering her question. "The second individual in this photograph was an asset connected to a classified network that was using 214 as a cover operation. That network has been under investigation for the past 8 months." A pause. "The investigation was escalated 4 days ago when Callahan communicated to his handler that he believed his cover had been compromised and that he was being surveilled by someone with access to his medical history." 4 days ago, Claire did the math without showing it. Frey wasn't just treating Callahan off the books 14 months ago, she said. He was being used as an access point. Someone fed Callahan's identity to Frey, and Frey provided clinical access in return. That's the working theory. "And when Callahan came in last night, Someone activated Frey. The man closed the laptop. We believe the call came in approximately 20 minutes after Callahan arrived in your emergency bay, before your unit showed up, before we had any presence here. Whoever made that call knew Callahan was at this hospital before we did. The room was quiet. Claire was running it forward. The sequence, the logic, the specific shape of what had happened in that trauma bay. Frey arriving. The speed of the surgical decision. The particular choice of left side decompression on a patient whose chart already contained documented evidence pointing right. The chart alteration, the reclassification of her notes, not just to cover a clinical error, but to remove the documented evidence that a more careful approach had been recommended, so that when the outcome was reviewed, it would look like a tragic and straightforward mistake. He expected me to be gone, she said. What? When he made the surgical decision, he expected me to already be out of the trauma bay. When I spoke up, he had me removed. If I'd left the building when security escorted me out, she stopped. The chart alterations happened after I left the bay. He thought the evidence was clean. He didn't know I'd written my own notes. Voight, who had been silent through all of this, said, "The notebook." "The notebook," Claire confirmed. "We're going to need that as part of the record." "You'll have it." Claire looked at the whiteboard, at the initials beside the case number beside Frey's name. "Who is the second person in that photograph?" The unnamed man looked at her for a moment. "That's what we're still working on," he said. "And that's why your recollection of 214 matters. The asset connected to that network, they were present during the operation. Not as personnel, as a contractor." He paused. "A medical contractor." Claire went very still. She thought about the operation, the forward staging area, the 12-day timeline, the 2 extraction events, and the 1 event that hadn't been an extraction. She thought about the contractor medic who had been attached to the unit for the second phase. Not someone she'd known before, not someone she'd requested, someone who had arrived with the right credentials and the right equipment and had done their job well enough that she hadn't questioned the arrangement until afterward, until a debrief comment from one of the operators had made her wonder about a specific supply chain decision that hadn't added up. She had filed a supplementary note with that debrief. She had not, until this moment, known whether anyone had read it. "The supply chain anomaly," she said. "The medication requisition in week 2. The unnamed man leaned forward slightly. "Tell me about that, Todd." She talked for 22 minutes. She talked about it the way she always talked about operational events, in sequence, in specific detail, without editorializing, because the value of the information was in the precision, and editorializing was what you did when you wanted to be believed, rather than when you wanted to be accurate. The unnamed man listened without taking notes, which meant he was recording it, which she had assumed from the moment she walked in. When she finished, he sat back. "The medication requisition," he said. "You believe it was used to create a documentation record that established a false administrative connection between 214 and a private medical network operating outside DoD oversight. I believe it created a paper trail that would allow someone to claim Callahan had received treatment through that network system," Claire said, "which would give them a legitimate-looking basis for having his identity and medical history. A basis that didn't look like intelligence theft. A legal cover story." "A legal cover story," she agreed. Voight said, "And you believe the contractor medic created that trail deliberately?" "I believe the medication requisition didn't match the treatment record I kept. The numbers were off by a margin that was too consistent to be arithmetic error. Someone was skimming the documentation." She paused. "I didn't have enough to make an allegation. I noted the discrepancy. I don't know what happened to that note." "It was flagged and then buried," the unnamed man said, "by someone in the oversight chain who we are currently also looking at." He said it flatly, without visible frustration, the way people say things when the frustration has been metabolized into something more durable. "Miss Weston, the note wasn't ignored, it was actively suppressed." The room absorbed that. Briggs unfolded his arms and put both hands flat on the table, which was the closest he'd come to showing what he was actually feeling since Claire had walked in. "How many people knew about this before last night?" he said. "Fewer than 10, the man said. "Now we know more because of what happened in that OR." He looked at Claire. "If Callahan had died on that table last night, this investigation would have hit a wall we might not have gotten around. His testimony is the operational link. Without it, everything else is documentary and circumstantial. Then the surgery wasn't just about silencing a witness, Claire said. It was about collapsing the evidentiary chain. Correct. She sat with that for a moment. With the weight of it, the specific vertiginous weight of understanding that the events of the last 8 hours had not been a contained incident at a single hospital, but a pressure point in something larger and older and considerably more deliberate. What do you need from me now? She said. Your formal statement on 214, your notebook as evidence, and your availability for the next 48 hours in case we need clarification. He paused. We'd also ask that you not discuss the operational dimensions of this with anyone not currently in this room. Understood. She stood up. Briggs walked her to the door. In the corridor, out of earshot of the room, he stopped her with a hand briefly on her arm, just a touch, just enough to make her stop and look at him. You saved his life twice, he said. Once in a place that doesn't exist on any map, and once last night in that room. He held her gaze. I know you didn't do it for any reason except the obvious one, but I want you to know that it matters, that Callahan matters, that... He stopped. He was a man who was not comfortable with the words in this particular category, and was making himself use them anyway, which was its own kind of courage. You matter. Whatever happens next. That's not going to get lost. Claire looked at him. Get your unit rotated, she said. You've had people standing in corridors all night. They need food and sleep. He almost smiled. Yes, ma'am. She went back to work. The morning shift at Harlow General moved forward with the particular stubborn momentum of institutional routine, which does not pause for crises. It reroutes around them and keeps going, because the patients don't stop needing care because something significant has happened in an administrative conference room. Claire was aware of this, and she was grateful for it, because the work gave her something to do with her body while her mind continued to process everything it had taken in. She did her rounds, she checked on 4 patients on the critical care floor, updated 2 charts, had a 10-minute conversation with a night shift respiratory therapist about a patient in Bay 6 whose oxygen saturation had been trending in a direction nobody liked. She drank half a cup of coffee that had been sitting on the nursing station for longer than was advisable. She was on her way back from Bay 6 when she saw Frey. Not in the physician's lounge, not in a conference room. In the main corridor of the second floor, being walked, not quite escorted, but walked, in the purposeful way of people who are moving someone from one place to another and want it to look voluntary, by 2 people Claire didn't recognize. Administrative security, she thought, or possibly federal, because their IDs were clipped too high on their jackets, and they moved with a quality of attention that the hospital's regular security staff did not have. Frey was in street clothes. Not his surgical clothes from the night before, so different clothes, which meant he had gone to his office at some point between the physician's lounge and now. He had a bag over his shoulder. The bag was the thing that made it real somehow, the visible sign that he understood he was leaving and had taken the time to prepare for it. He saw her. The corridor was wide enough that they didn't have to interact. There was no procedural reason for either of them to speak. The 2 people walking Frey showed no sign of slowing down, but he stopped. Not long. 3 seconds, maybe 4. His escorts paused without comment, which was itself a communication. They had clearly been told that this moment might happen and had decided in advance to allow it a small amount of time. Frey looked at Claire the way a person looks at something they have underestimated and are now seeing clearly for the first time, which is a complicated look because it contains more than one emotion and none of them are comfortable. I looked at your personnel file this morning, he said. Before, he gestured vaguely at the bag, at his own situation. Someone should have looked at it 8 months ago. Claire said nothing. For what it's worth, he said, the night I removed you from the bay, I knew, on some level, that you were right. Not about the specific pathology. I didn't get there yet. But about the pattern. I knew the pattern was worth a second look. He stopped. And I still had you escorted out, because it was easier than being wrong in front of my team. I know, Claire said. I'm not asking for anything with that, he said quickly. He looked at her. He looked like he hadn't slept, which he hadn't, and he looked like a man who is used to being certain about things and has suddenly lost that certainty and doesn't quite know what to do without it. I'm telling you so that it's on record somewhere, that I knew, that I made a choice. She looked at him for a moment. It's on record, she said. All of it. His escorts resumed walking. He went with them, not looking back, and Claire stood in the corridor until they turned the corner and were gone. And then she stood there for another moment after that because she needed it, and there was no one watching. She had imagined this moment before, not in specific detail, but in general terms, the way you imagine the resolution of a thing that has been sitting wrong in your chest for months. She had imagined feeling something cleaner than what she actually felt, which was tired and complicated, and aware that Frey's departure from this corridor was not the end of anything, only the visible surface of a much larger consequence that would take months to fully arrive. She went back to the nursing station and wrote her formal statement. Garrett Hale found her at noon. He had clearly not slept either, and he had the look of someone who had spent the morning in a series of conversations that had dismantled something he'd believed about himself, which is a particular kind of tired that rest doesn't immediately fix. He was still in his residence badge, which meant he hadn't been fully suspended yet, only reassigned to non-clinical duties pending the review, which was its own kind of limbo. "Miss Weston," he said. He stopped a few feet away, which was respectful, and he held his hands in front of him in a way that was not defensive but deliberate, like someone who had rehearsed this moment and was trying to do it right. "I need to say something." "Then say it," she said. "I altered those chart entries because Dr. Frey told me it was standard documentation management. He said your notations were imprecise and that reclassifying them would prevent confusion for the surgical team." He swallowed. "I knew it was wrong. I didn't know how wrong, and I did it anyway because I didn't want to be the resident who challenged Frey." He paused. "The patient would have died." "He almost did," Claire said. "I know." The word came out stripped down to its bare function. "I've been thinking about that all night. About the specific fact that I moved those entries and then stood in that OR while the wrong approach was being set up, and I thought about saying something, and He stopped. "I didn't." Claire looked at him. He was 27 years old, which she knew from the hospital directory, and he had the face of someone who had been very good at things for his entire life and had not yet developed a full accounting of what he was capable of doing wrong. "You're going to have a long career," she said, "if you're allowed to continue." She kept her voice even, not unkind, but not softened either. "This is going to be part of it for a long time. What you did with it tonight and what you do with this, both of those things are going to matter." He nodded. He looked like he wanted to say more and didn't have the words yet. "Go home," she said. "Sleep. Come back when they call you and tell the truth in exactly the same way you just told me." He left. Paulette, who had been within earshot at the nursing station, said nothing for a full 30 seconds. Then she said, "You're exhausted." "I am." "Your shift ended 4 hours ago." "I know." "Claire," Paulette said her name the way someone says a name when they want the person to actually hear it. "Go home. One more thing first." She went back to the recovery room. Callahan was sitting up, proper sitting up, adjusted bed, extra pillows, the particular posture of a man who has decided that horizontal is no longer acceptable, and has communicated this to the nursing staff with sufficient clarity that they've accommodated him. He had more color than he'd had at 6 a.m., and he was holding a cup of actual coffee, which meant Ortega had either cleared it or Briggs had smuggled it in, and she didn't ask which. Briggs was in the chair beside the bed, which was familiar territory for him by now. "You're still here," Callahan said when she came in. "One more thing," she said, which was what she'd told Paulette, and which was also true. She pulled up the secondary chair, the one that had been pushed against the wall since early morning, and sat down. "Tell me about the contractor medic from 214, what you actually remember." Callahan looked at Briggs. "She's cleared," Briggs said. Callahan looked at Claire. He set his coffee down on the bedside table with the careful movement of someone whose right side was reminding him hourly of what had happened to it last night. "I didn't know, at the time," he said. "During the operation, I mean. I had no reason to question the contractor. They were competent, They had good gear, they knew the protocols. A pause. It was 3 months afterward. I ran into them at a DoD medical conference, a small one, not public. And the way they reacted when they saw me was wrong. Not recognition wrong, access wrong. Like they were startled that I was there, at a conference that shouldn't have been on their radar unless they had a different level of clearance than their contractor status allowed. You reported it? I flagged it to my handler, who told me it had been looked at and cleared. His jaw tightened slightly. 8 months later, I started noticing surveillance patterns around my personal medical appointments. Nothing definitive, nothing I could document cleanly, but I've been doing this long enough to know what being monitored feels like. And then 4 days ago, you told your handler your cover was compromised. 4 days ago, someone accessed a private health record of mine through a system that has no legitimate connection to any organization I'm authorized with. He looked at her. I have a standing injury from a previous operation. Managed, but documented. The access was to that record. Whoever pulled it wasn't looking for current medical data. He paused. They were confirming my identity through a secondary channel, which means the primary channel, the one they'd been using, had been burned somehow. Or they were double-checking before they moved, Claire said. That's what I think. The room was quiet for a moment. 4 days ago, Claire said. And then 4 days later, you end up in our trauma bay. I was not supposed to be in Asheville, he said. The op I was running was 300 miles from here. I got pulled off course by a situation I can't detail, and this was the nearest facility. He looked at his hands, at the IV line, at the medical tape on his forearm. I don't think it was a coincidence that the facility I ended up at had a physician already in the network. I think I was moved. Moved, Briggs repeated. You're saying someone directed you toward this hospital. I'm saying the situation that pulled me off course had elements that felt managed in retrospect, and this was the nearest major trauma facility on that route. He met Briggs's eyes. I've been sitting here all morning thinking about the route. The silence this time was different from the earlier silences. It had a specific gravity to it, the weight of a hypothesis that nobody wanted to say out loud because saying it out loud made it real and made it larger and made what had happened last night not just an attempted murder in a trauma bay, but the endpoint of a coordinated 4-day sequence. The unnamed man in the conference room, Claire said. Does he know this? Tell him, Briggs said to Callahan. Callahan nodded. When you go back up there, tell him the name Delacroix. He'll know what it means. He looked at Claire with the steady attention that was, she was realizing, simply his default mode. A man who had spent years observing and calibrating and making accurate assessments of people under conditions that didn't allow for error. You're going back up there. It wasn't a question. After I sleep, she said. Before you sleep, he said. She looked at him. Delacroix is not going to wait, he said quietly. Whoever moved me onto that route, whoever activated Frey, if they know the surgery failed and Frey is in custody, they know the evidentiary chain is intact. They are not going to sit still for the time it takes you to get 8 hours of sleep. He held her gaze. I'm sorry. I know what I'm asking. You're not asking, she said. You're informing. Yes. She stood up. She was bone-tired in the specific way of a body that has been running on adrenaline and professional obligation for too many consecutive hours. The kind of tired where the edges of things start to look slightly imprecise, and you know that the precision you normally have is costing more than usual to maintain. She also knew he was right. She was also, if she was being honest with herself, not done. Not in the way that duty required her to not be done, but in the deeper way, the way that had nothing to do with obligation and everything to do with the part of her that had never been able to walk away from an incomplete picture. Delacroix, she said. That's the contractor. That's the contractor, Callahan confirmed. And the photograph in the conference room said, the second figure beside Frey. He looked at her. Is it Delacroix? She said. Something crossed his face. Not surprise, but a recalibration. A man realizing that someone had gotten ahead of where he expected them to be. You're fast, he said. I've had a long night to think. She picked up her notebook from the chair. Rest, Let Briggs debrief you properly when you're stronger. I'll be upstairs." She left the recovery room. In the corridor, she paused outside the door and stood for a moment under the fluorescent light that still hummed slightly off-key, in the same corridor where she had stood the night before when she was waiting to see what a convoy of armored vehicles in an ambulance bay would mean for the next 12 hours of her life. She hadn't known then. She had a clearer picture now, and the clearer picture was not less complicated. It was considerably more complicated, but she had always found that clarity, even of a difficult kind, was better than the alternative. She started for the stairs. She was on the second step when her phone buzzed. A text from a number she didn't recognize. Not Briggs, not Voight, not any of the investigators she'd been talking to all morning. An unknown number that had sent a single photograph. She stopped on the staircase. She opened the photograph. It was taken inside the hospital. She could tell by the lighting, by the particular shade of the linoleum in the background, by the corner of a supply cart visible at the left edge of the frame. It had been taken within the last 4 hours. She could tell by the fact that Paulette was visible in the background, and Paulette had not been on shift before 7 a.m. The photograph was of Claire, taken from a position that should not have been accessible to anyone without staff credentials or a specific knowledge of the hospital's camera blind spots. Taken from the same corridor at the same angle as the gap in coverage she had flagged in the facilities meeting 6 months ago, the one that had never been addressed. Beneath the photograph in the text message were 4 words. "You should have left." She stood on the staircase for 3 seconds. 3 seconds was enough time to make the decision she needed to make, which was not the decision to be afraid. She had already made that decision, which was actually the decision not to perform the opposite of fear, but to simply acknowledge it as information and move on. But the decision about sequence. What first? What next? What the text message was designed to make her do, and therefore what she should do instead. The text was designed to make her stop, to make her go back down the stairs, find Briggs, hand over the phone, remove herself from the forward position she'd occupied since 11:47 p.m. It was designed to remind her that she was visible, and that being visible had costs, which was a message she'd been receiving in various forms since she arrived at Harlow General 8 months ago, and which had never once made her do what the sender wanted. She forwarded the message to Briggs with a single line, "Unknown number." Taken from the camera blind spot on 2. Someone in the building, then she went up the stairs. The unnamed man was still in the conference room. He had acquired a second laptop and a printed set of documents that were face down on the table, which was a gesture towards security that Claire recognized as habitual rather than necessary, given that the only people in the room were already cleared. She handed him her phone. He looked at the photograph. He looked at the text. He looked at her. "You're still standing here," he said. "Callahan gave me a name," she said. "Delacroix." The room changed. Not visibly. Nothing moved, nobody made a sound, but the quality of attention in it shifted the way air shifts before a pressure change. The unnamed man set her phone on the table with a careful, deliberate movement. "Say that again," he said. "Delacroix. He said you'd know what it meant." The man looked at Voight. Something passed between them that was not a conversation but contained the substance of one. "Sit down, Ms. Weston," Voight said. Claire sat. "Delacroix is not a name," the man said. "It's a designation. Internal shorthand for an operation that has been running parallel to the 214 investigation for 11 months. We use it in this room only." He looked at her steadily. "Callahan knows it, because he's been an active cooperating source in that parallel investigation. He should not have used it with you unless he assessed me as someone who needed the full picture immediately," Claire said. "Because the situation had changed." "What's changed?" She told him about the route, about Callahan's belief that he had been directed toward Harlow General specifically, about the 4-day sequence, the record access, the surveillance patterns, the compromised cover, and the possibility that the end point of that sequence had not been improvised but planned. The man listened without interrupting. When she finished, he was quiet for a moment that was not hesitation but processing. "If Callahan was moved onto that route deliberately," he said, "then whoever directed him here had prior knowledge of Frey's presence at this hospital. which means the network we've been tracking has been mapping medical assets, civilian facilities with embedded contacts, as contingency infrastructure. He paused. That's a larger organizational footprint than our current assessment. It also means, Claire said, that the photograph sent to my phone was taken by someone who is still in this building, someone with staff credentials or physical access. We're aware. Voight already had her own phone out. Building lockdown is being coordinated with hospital security right now. Exits are being covered. The blind spot on the second floor, Tim, Claire said. Whoever took that photograph knows the camera coverage gap. That's either a staff member who's been here long enough to learn the building, or someone who was given specific facility intelligence. Or both, Voight said. Or both, Claire agreed. The unnamed man looked at the face-down documents on the table. He turned them over. They were personnel files, not hospital personnel, she could tell by the format, which was federal, and he spread 3 of them in front of her. Do you recognize any of these individuals? He said. She looked at the photographs. 2 men and a woman, none of whom she knew. She shook her head. He placed a 4th file on top. She looked at the photograph. It took her a moment, 2 seconds, maybe 3, because the photograph was formal and the person she was looking at in her memory was not formal. They were in field gear. They were backlit by equatorial sun. They were handing her a medical kit with a specific 2-handed grip that meant something in a context she no longer occupied. But the face was the same. That's the contractor medic from 214, she said. Yes, he said. The name on the file was not Delacroix. It was a real name, a full legal name, a woman in her mid-40s with a credentials list that was extensive and, Claire could now see, partially fabricated, the fabrication subtle enough that they would pass a standard background check, but not a forensic one. She's been in the building, Claire said. It was not a question. We believe she was admitted through a side entrance at 4 a.m. using a temporary contractor badge issued 2 days ago for what was listed as a medical equipment audit, Voight said. The audit was not requested by any hospital department. The badge was issued by the facilities office through a process that is currently being reviewed. She's been here for 5 hours, Claire said. Yes. And nobody flagged it until the photograph. The badge was legitimate on its face. Nobody had a reason to look at it twice. Voight paused. Until now. Claire absorbed this. 5 hours was long enough to have done a great many things. Accessed records, mapped personnel movements, positioned herself in the building. Long enough to have taken a surveillance photograph from a corridor blind spot and sent it from a burner number to a phone whose number she had obtained through the same intelligence channel that had given her Callahan's identity. Long enough to have done things that had nothing to do with a photograph. Callahan, Claire said, and she was already standing. She covered the 2 floors to the recovery ward in 90 seconds. Tate was not at his post in the corridor outside the recovery room. That was the first thing she noticed, the specific absence of the soldier who had been there continuously since before dawn, whose presence had become part of the background of this floor, the way certain sounds become part of a room's silence. The chair where he'd been sitting for the last 6 hours was empty, and the corridor had that particular too quiet quality of a space where something has recently changed. She pushed through the recovery room door. Briggs was on his feet, which was the second thing she noticed. He was standing at the window, not looking out, not relaxed, but positioned with the alert stillness of a man who has just assessed his environment and doesn't like what he found. Callahan was in the bed, upright, IV intact, and scanning the door with the focused attention of a man who has been watching it since the last time someone came through it. Tate, Claire said. He went to check the corridor camera when he got my text, Briggs said. That was 9 minutes ago. He's not answering his radio. 9 minutes. She'd spent 6 of those in the conference room upstairs. Delacroix is in the building, she said. Contractor badge, admitted at 4 a.m. She's been here 5 hours. Briggs's hand went to his radio. The exits are being covered, Claire said. Voight's people are moving, but if she's been here 5 hours and she knows the camera gaps, she knows where not to be when the exits close, Briggs said. Yes. Callahan swung his legs off the bed. The effort it cost him was visible in his jaw, in the controlled quality of his breathing, but the movement itself was decisive, and Claire didn't stop him because she understood that this was not negotiable. "Don't," she said anyway. "I'm not staying in this bed," he said. "You have a repaired intercostal tear, and you've been under anesthesia for 2 hours. You are not—" "Claire." He said her name the way Briggs had said it earlier, the way people say a name when they need you to stop being right for a moment and listen to them. If Delacroix is in this building, she didn't come here to finish what Frey started. She came to clean up what Frey left behind. He held her gaze. That includes the evidence chain, the notebook, the statements already given. A pause. You. The word landed in the room with its full weight. She had known it, on some level, since she'd opened the photograph on her phone. She had processed it the same way she processed most things under pressure. Quickly, practically, without allowing the emotional dimension to take up more space than it was useful for. But hearing it said directly, by someone who meant it as a statement of fact rather than an attempt to alarm her, had a different quality. "Briggs," she said, "I need Tate found." "Already on it." He had his radio up and was moving. "And I need someone with Paulette. She's been documenting this from the beginning. If Delacroix has been watching the floor—" "Sending Reyes," Briggs said, naming the unit member she'd seen least of, who had been rotated to a secondary corridor position. She hadn't questioned it. She should have mapped all of their positions at the start of the day. She filed that away as a lesson for a situation that was not currently happening. Callahan was standing. He was holding the IV pole with his left hand, and he was pale, and his breathing was doing something that Ortega would have strongly objected to, but he was standing. "Tell me what you need," he said. "I need you to not fall down," she said. "That I can probably manage." "Probably," she said, and it came out almost the way she'd meant it, which was as something that was not quite a joke, but was adjacent to one, which was the closest either of them was going to get to humor in the next several minutes. She took out her notebook. The notebook was the thing Delacroix needed, and Claire had known it since the conference room and had not said it out loud because saying it out loud served no purpose beyond confirming what everyone in that room had already understood. The notebook contained her field medical record from 214, not the formal report, not the institutional record, but her personal notes, written in real time, in the small, precise handwriting of a person who had been keeping parallel records for exactly this kind of situation. The notebook contained the medication requisition discrepancy. It contained dates, quantities, the specific phrasing she'd used in the supplementary debrief note that had subsequently been buried. It contained things that the formal record had been scrubbed of. It was, in the language of the investigation currently being coordinated from the fourth-floor conference room, irreplaceable primary source material. She put it inside her scrub top, against her sternum, where it had been when she was running field operations, and the standing order was that your records went with your body, and if your body was unrecoverable, the records were unrecoverable too, which was a policy that had always struck her as grimly logical. Then she thought about what Delacroix would do if she couldn't get the notebook. The answer was, use whatever else she had available, the digital records, the chart access log Paulette had printed and preserved, the statement Claire had given Voight that morning, which was filed in the federal investigation record. Delacroix couldn't erase all of that. It was too distributed, too many copies in too many places. But she could create enough interference, enough doubt, enough procedural disruption to buy time. Time for lawyers. Time for the higher chain that had buried Claire's debrief note to do it again with this record. What Delacroix actually needed was not the notebook. What she needed was for Claire not to testify. The realization arrived with the particular coldness of a thing that has been true for a while and has only just been looked at directly. She stepped into the corridor. Briggs was at the far end, radio to his ear. He looked at her and raised 2 fingers, which in the unit's communication system apparently meant 2 minutes, which meant Tate had been located, or they had a fix on Delacroix, or both. She moved toward him. She was 12 feet from him when the stairwell door at the near end of the corridor opened. The woman who came through it was in hospital scrubs, blue, the right shade, the right fit, with a contractor badge clipped at mid-chest and the particular unhurried walk of someone who belongs where they are and has rehearsed belonging so thoroughly that the performance has become indistinguishable from the real thing. She was in her mid-40s, compact, with short-cropped dark hair and the kind of face that doesn't read as memorable, which was almost certainly a professional asset. She and Claire looked at each other from 12 feet apart. There was a moment, 3 full seconds, maybe 4, that was not a standoff in the dramatic sense, not a movie moment with swelling music and held breath, but simply 2 people looking at each other across a hospital corridor with the weight of several years between them and a very specific present tense problem connecting them. Then Briggs said, from the far end of the corridor, "Hands where I can see them, right now." Delacroix looked at Briggs. She looked at the 2 unit members who had appeared behind him, which Claire had not tracked but which Briggs apparently had, because he'd been 1 step ahead of this since the radio exchange. She looked back at Claire. She put her hands up. Not slowly, not dramatically, practically, with the specific efficiency of a person who has made an accurate calculation and acted on it. Her expression didn't change much. There was something in it, not regret exactly, but a kind of professional acknowledgement, the look of someone who has been outmaneuvered and is extending that acknowledgement to the person who outmaneuvered them, because refusing to do so would be its own kind of lie. "The notebook," she said. It was directed at Claire. "You already moved it." "An hour ago," Claire said. This was not true. She had moved it 4 minutes ago. But the specific timing didn't matter, and the communication did. That she had seen this coming, that she had not been caught waiting, that the thing Delacroix had come for was not where Delacroix had expected it to be. Delacroix nodded once, the nod of a person closing a calculation. Voight's people came through both stairwell doors simultaneously 30 seconds later, which was the kind of coordination that suggested the last 9 minutes had been considerably more organized than Claire had been able to see from her position in the middle of it. Delacroix was taken into custody with no resistance and no performance. She went with the same practical efficiency she'd brought to everything else, which was in its own way more unnerving than a scene would have been. Tate appeared from the supply room 2 doors down. He had a bruise forming on his left cheekbone and a cut above his ear that had been addressed with what appeared to be a strip of medical tape applied by himself. He looked at Briggs with the expression of a man who has a great deal to say and is choosing the context for it carefully. "Later," Briggs said. "Yes, sir," Tate said. The next 4 hours were federal process, which is to say they were thorough and slow and involved a great many people entering rooms where other people were already sitting. Claire gave 2 more statements, one to Voight, one to the unnamed man who eventually told her his name was Harker, which she suspected was also not his name but was at least a name. And in between statements, she sat in the family consultation room with a cup of coffee that was better than the one from the nursing station, and wrote the final entries in her notebook before she handed it over. She wrote the entries carefully. Not because she was performing carefulness, but because the record deserved to be complete, and completing it meant writing the parts that were hardest to write. The part about standing in the corridor after Frey was escorted out, and feeling tired and complicated instead of vindicated. The part about Callahan's face when he'd said you should have left to the room, to the version of events where she had, in fact, left. She wrote those parts in the same small, precise handwriting, and then she closed the notebook and set it on the table. Harker picked it up. He looked at the cover, unmarked, plain, the kind of notebook you could buy anywhere, and then at her. "This is the original?" he said. "Everything in it is dated and sequenced from the time of the event it documents," she said. "The handwriting is consistent. You can verify it against my service records." "We will." He paused. "Ms. Weston, the investigation into the network connected to 214, what Delacroix was running, what Frey was an asset in, this is going to take months to fully adjudicate. There will be subpoenas, depositions, possible federal testimony." He looked at her. "You're at the center of the evidentiary chain." "I know." "Are you prepared for what that looks like? Practically, in terms of your life here, your position at this hospital?" "I'm prepared," she said, and she meant it in the specific way of someone who has thought about it rather than the reflexive way of someone who wants the question to stop. He nodded. He seemed to believe her, which was appropriate because she was telling the truth. Kellner found her at 4 in the afternoon. She was in the corridor outside the recovery ward. Not going in, not leaving, just standing in the space between the 2 things, which was becoming something of a habit for her at Harlow General, This particular corridor with its off-key fluorescent hum and its view of the parking structure where Frey's car had finally been moved. Moved by federal process, she assumed, which had its own specific image. "I've been in meetings since 6 a.m., Kellner said. "I know, I've been in some of them." He stood beside her. He didn't try to position himself in front of her or across from her, which she noticed. He stood beside her and looked at the same section of corridor she was looking at, which was a way of having a conversation that she appreciated. "The board voted this morning," he said. "Frey's position has been formally vacated. The fellowship program bearing his name is being suspended pending review." A pause. "The hospital is also beginning a full audit of surgical case records going back 30 months. Any case where nursing documentation was reclassified or downweighted in the triage system will be re-examined." "How many cases?" she said. "Preliminary estimate is between 14 and 20. His voice was carefully controlled. "We don't know yet how many outcomes were affected." 14 to 20. She held that number without flinching, because flinching wouldn't change it, and the number needed to be held clearly, without the distortion of someone who wanted it to be smaller. "The protocol changes you recommended," Kellner said. "Equal clinical weight to documented nursing observations and surgical planning. Automatic second review trigger when the surgical approach contradicts nursing intake notes from the prior 2 hours. We're implementing them. Not as a pilot, not as a trial. Full implementation, effective next Monday." She looked at him. "There's also a position," he said. "Director of Critical Response Standards. It's not an existing position. The board created it this morning. The mandate is to redesign the hospital's emergency clinical protocols from the ground up, with particular emphasis on interdisciplinary accountability." He paused. "With authority to challenge surgical decisions. Formally. With teeth." The word authority hung in the corridor air between them. She had not come to Harlow General 8 months ago looking for authority. She had come looking for something quieter, a version of her skills applied in a context that didn't require the constant risk assessment that combat medicine demanded, a place where she could be useful without the particular weight of knowing that a wrong decision had the immediate geography of a battlefield and the immediate timeline of seconds. She had not found quiet, exactly, but she had found something she hadn't anticipated finding, which was the discovery that the thing she was best at was not a skill set that could be reduced to a context. It was just how she moved through problems. "What's the salary range?" she said. Kellner blinked. Then he told her. "I'll need a week to think about it," she said. "Take 2, he said. "You've earned considerably more than a week." He left. She stood in the corridor alone for a moment. Through the recovery room window, she could see Callahan sleeping. Actual sleeping this time. Not the precarious unconsciousness of an hour post-surgery, but the real kind. The kind that meant his body had decided the emergency was resolved and was doing the maintenance work. Briggs was in the chair beside him, also asleep, which she had not expected to see because she had not quite thought of Briggs as someone who slept. She pushed the door open quietly and stood just inside it. The room was dim and warm, and the monitors were making their steady sound, and there was something about the particular combination of those things, the dim light, the steady sound, 2 people who had been in impossible places and had come out the other side sleeping in chairs, that made the exhaustion arrive in her fully and completely, not as a wave this time, but as a settling, the way a building settles when the day's heat finally leaves it. She pulled the secondary chair from the wall. She sat down. She did not sleep. Not yet. But she let herself be still for the first time in 20 hours, which was its own kind of rest, and she sat with the specific weight of what the day had been. All of it. From the parking lot at the beginning of the night shift to the corridor 4 hours ago. And she did not try to resolve it into something neater than it was. It wasn't neat. It would not become neat. 3 people had been in that recovery room with her at various points in the last few hours, who were now in federal custody, and the process that would follow would be long and procedurally ugly and would require her to stand in rooms and say the same things many times until the weight of repetition made them feel worn down even though they were true. Frey would have lawyers. Delacroix would have lawyers. The higher chain that had buried her debrief note would have lawyers, and those lawyers would look for every angle, every inconsistency, every way to characterize what Claire had done as overreach, insubordination, a night nurse who didn't know her place. She knew what she knew. She had written it down. She would say it clearly, as many times as necessary, for as long as it took. Callahan woke up at 5:15 p.m. He registered the room the same way he'd done it the first time. Ceiling, monitor, person in the chair, and when he got to her, his expression settled into something that was tired and clear and without performance. "You stayed," he said. "Someone had to make sure you didn't try to stand up again." That was one time. It was extremely memorable. She leaned forward in the chair. "How's the pain?" "Present," he said. "Managed." He looked at the window, at the light outside that had shifted from morning white to late afternoon amber. "Is it over?" "The immediate part," she said. "The rest is going to take a while." He nodded. He'd known that. "The testimony," he said. "When it comes, I'll be there," she said. "It's going to be complicated." Most true things are. He looked at her with the steady attention she'd come to think of as simply how he engaged with the world. And then he said, "You know what I thought about in the OR when I was under? You were under general anesthesia. You weren't thinking about anything. Before," he said, "when I was still conscious, in the bay, before they put me under." A pause. "I thought about the fact that I'd been in worse situations, and the reason I was still here for the worst situations was because of a combat medic in a forward staging area who stayed with me for 11 hours while we waited for extraction, who didn't leave." He looked at her steadily. "You didn't know my name then. You just knew I was someone who needed to not die." She looked back at him. "That's the job," she said. "No," he said. "The job would have been 40 minutes and a handoff. What you did was different." He paused. "What you did last night was different. Not because of the skill, although the skill is," he shook his head, "because of the decision. To stay. To say the thing out loud when saying it had a cost. Every time." He looked at his hands. "Most people don't do that. Most people do the minimum that the situation technically requires, and then they protect themselves. And you don't." She was quiet for a moment. "I'm not—" She stopped. Tried again. "I'm not saying this to be modest, but I stay because I can't leave. It's not a virtue. It's just how I'm built." "Maybe," he said. "But the world benefits from how you're built." She didn't have an answer to that wasn't going to sound like either deflection or agreement, and she was too tired to navigate between them gracefully, so she let it sit. Outside the window, the light kept changing. 6 days later, Harker's team arrested 2 additional individuals connected to the network, both in other states, both identified through the documentation chain that had originated with the 214 medical records and led, through a sequence of financial transactions and facility accesses, to a private medical intelligence operation that had been running for nearly 5 years. The operation's purpose, as Harker eventually communicated to Claire in a briefing that was classified and which she would never be able to describe in full, had been the systematic mapping and occasional compromise of medical personnel with access to military contractors and active classified operatives. Frey had been one of 11 civilian medical professionals identified and recruited across 7 states. 11. She sat with that number the same way she'd sat with 14 to 20. Frey entered a cooperation agreement with federal prosecutors 3 weeks after his suspension, which bought him reduced charges and a public statement acknowledging what he had done. The statement was clinical and carefully worded by lawyers and contained very little of what Claire had seen in his face in the physician's lounge. The exhaustion, the acknowledgement, the complicated thing that wasn't quite remorse but was adjacent to it. And she read it once and put it down and didn't read it again, because what she needed from that document she had already gotten the morning she watched him walk down the corridor with his bag. Garrett Hale's situation took longer to resolve, because situations involving people who made bad decisions under institutional pressure always took longer because the question of culpability in those cases was genuinely harder to answer than the question of culpability in cases involving people who had made decisions freely. He was suspended for 60 days, required to complete an ethics program, and placed on supervised practice for a year. Claire was not asked to provide a character statement. She gave one anyway. She wrote it in the same small, precise handwriting, and she was honest in it, which meant it contained both what he had done and what she had seen in the parking structure doorway. And she sent it to the review board with a cover note that said she was not asking for leniency so much as she was providing accurate information about the full picture. And that accurate information about the full picture was, as far as she was concerned, always worth providing. The director position at Harlow General took her a week and a half to accept. Not because she was unsure, she was sure within about 3 days, but because she wanted to be sure for the right reasons, and testing the reasons took time. She accepted it on a Thursday morning in Kellner's office with a single condition: that the authority the position carried was formally documented in the hospital's clinical protocol charter, not as an informal understanding between people, but as a structural feature of the institution that would outlast the people currently in it. Kellner signed the documentation before she left the room. The unit came back in the 3rd week of November, not for a medical emergency. The hospital had had 3 of those since Callahan's surgery, all handled differently than they had been before, all involving the new protocol that gave nursing documentation equal clinical standing, and none of them had gone wrong. They came back on a Tuesday afternoon when the weather had turned and the parking lot had the first ice of the season on it, and they did not come through the emergency entrance. They came through the main entrance, all 6 of them, in dress uniform, which she had not seen them in before, which was different from combat dress the way all formal things are different from functional ones, carrying weight of a different kind, saying something about the occasion that cannot be said in field gear. Briggs was in front. Claire was in the main corridor when they came in, not waiting for them, not positioned, genuinely in the middle of walking from one place to another with her notebook under her arm and a chart she'd been reviewing. And she stopped when she saw them, because stopping was the only available response. Paulette was at the nursing station. Ortega was coming out of an exam room. 3 other nurses and 2 residents were in various positions along the corridor. And the strange thing, the thing Claire would think about later, the specific texture of the moment, was how all of them stopped without anyone saying anything. The way people stop when they recognize that something is happening that is larger than the ordinary movement of the day. Briggs looked at her across the lobby. He had a case under his arm. A presentation case, the flat kind used for formal military documents. He walked toward her and the unit walked with him, not in formation but together, which was different. And when he reached her, he stopped at the distance of a respectful arm's length and said simply, "Stand still for a minute." She stood still. He opened the case. Inside it was a framed citation, military, formal, with seals and signatures that she recognized and that she was not going to describe, because the specific institutional language of military recognition was not the point. The point was what was written in the body of it, which she read once quickly while Briggs held it. She had been recommended for this citation by James Callahan, Sergeant Major Daniel Briggs, and 4 members of the Shadowlance Task Group for actions taken during 2 separate events, the first in a forward staging area 4 years ago, the second in an operating room at Harlow General, 8 months and 1 very long night after she'd parked in the back corner of a hospital parking lot and tried to take up less space. "This was approved 3 weeks ago," Briggs said. "We wanted to bring it in person." She looked at the citation, then she looked at him. "You drove 3 hours," she said. "We flew," he said. 3 hours was still an option, but we weren't going to do that. Behind her, someone in the corridor started clapping. She didn't turn around to see who. She thought it was Ortega, but she wasn't certain. And then someone else joined, and then several more. And the sound of it moved through the space the way sound moves in places with linoleum floors and high ceilings, bouncing and expanding until it filled the room in a way that had nothing to do with volume and everything to do with accumulated weight. She stood still through it. She did not perform composure, and she did not perform emotion. She simply stood in the lobby of Harlow General Hospital and let the moment be what it was, which was strange and genuine and completely unlike anything she had imagined when she'd walked into this building 8 months ago thinking she was building a quiet life. Callahan was not there. He was still in recovery, still months from full clearance, still in the long and imperfect process of healing from an injury that had come within 4 minutes of being an ending. She would see him again, Chab. She knew that, in the way you know things that have not happened yet, but have a sufficient weight of inevitability. She would see him in a deposition room, in a courthouse hallway, in whatever came after those. They would work through the aftermath together because the aftermath required it, and because some things that begin in a forward staging area at 2 in the morning do not end neatly, they just continue into the next thing. Briggs handed her the citation. She took it. She had spent a long time being the person in the back corner of the parking lot, the person who logged the anomaly and filed the note and watched it get buried, the person who said the right thing out loud in the wrong room and got walked to the door for it. She had spent a long time learning to take up less space, because taking up less space was the arithmetic of survival in places that were not designed to accommodate what she was. What she had not done, in all that time, was become the person those places wanted her to be. That was the thing she understood now. Not as a triumph, not as a resolution to a story, because her life was not a story with a resolution, it was a life, which meant it continued into Tuesday and Wednesday and the long, complicated months ahead, but as a fact about herself that she had not previously been able to see clearly. She had not become that person. And the world had noticed eventually, not because she'd asked it to, not because she'd announced herself or performed her credentials or waited for permission to be taken seriously, but because she had stayed in the room, because she had said the thing out loud, because she had stood in the corridor at 11:47 p.m. on a Thursday with a notebook in her hand and the right answer in her head, and she had not left the building. Paulette appeared beside her. "Go home," Paulette said. "After this, go home." "After this," Claire said. She looked at the citation in her hands, at the lobby filling with the ordinary traffic of a hospital afternoon, moving around this moment the way water moves around something solid, the day continuing in all its regular and important urgency. She thought about the quiet she'd been trying to build. She thought about the fact that she had built something instead. Not the thing she'd planned, not the version of her life she'd imagined when she'd parked in the back corner and told herself that staying small was a form of safety. Something harder. Something that had cost more. Something that, when she looked at it directly, in the imperfect and non-cinematic light of a Tuesday afternoon in November, she did not wish she had traded for the quiet version. She put the citation under her arm beside the notebook. She went back to work.